guys, Sierra Meacham here. I am the director here at Riverview Wellness. Welcome back to another episode of the Riverview Wellness Podcast. We have a super duper exciting episode today. We have our first guest on the show. So we've got Heather here. Do you want to introduce yourself? Say hello to the people.
I am Heather McCarol. I am a women's coaching specialist and a trainer here at Riverview Wellness.
And Megan.
Hey, I am Dr. Meghan Karol. I am a pelvic physical therapist.
So the reason that I wanted to have Megan on the show, this is the first time that I'm announcing this to the world. I'll probably have posted something by the time that this episode actually drops, but I am 12 weeks pregnant now. Super exciting, and it's kind of a new world for me, and pregnancy and exercise seems to be a studied area, but is somewhat limited research. I think people are afraid to just throw pregnant women into an exercise plan because there are some risks with that, a lot of unknowns. And so given Megan's area of expertise, she works with a lot of women in that world, and I think has a lot of super important knowledge when it comes to that. So, let's dive into it.
Let's get into it.
A ton of questions.
Yeah, because it's confusing. It's like you're going to see such a wide range. And as we were sort of chit-chatting before we hit record, we were kind of saying each pregnancy, each birth experience, each postpartum is going to be not just unique to you, but unique to that pregnancy and that birth experience and that postpartum. So there are going to be a lot of guidelines that we can kind of talk through and how we apply that to you and your pregnancy. But it's really hard to look into the wealth of online, good or bad information out there, and it's overwhelming. And then you're like, but what do I do? What do I do in this situation?
Yeah, absolutely. So I guess, would you say a lot of the clients that you see, because you see, I guess if you were to give a quick summary of all the different types of clients you see, because I know pregnancy is only one piece of the puzzle. Who all do you see? And then when it comes to pregnancy, postpartum, what percentage of those women are before they're pregnant, during, after, and I don't know what.
Yeah. So pelvic physical therapy is really pretty wide range. I always kind of joke from belly button to mid thigh, anything that's going awry in that area, pelvic physical therapy can probably help out with or give guidance, into. So that might be, urinary bladder leakage or, constipation, not being able to hold fecal stool, things like that, pain with intercourse, even just pelvic pain with day-to-day activity. I was kind of joking with a patient yesterday about it. I'm like, if you are feeling or noticing your vagina, that's not normal, right? You just so anything that's kind of bringing attention to that area is okay, something's not quite right there, and let's do something about that.
Yeah. Okay. And then as far as specifically
how much for? So I would say on my particular caseload, kind of 50% pregnancy, postpartum, and 50% more pain type conditions, mostly because a lot of people don't even realize they have a pelvic floor until they get pregnant, and then they're now what? Right?
Do I need to do Kegels? What do I need to do with my pelvic?
Exactly.
They hear all these things. I feel
So sometimes I'll get people who come in, and in my intake, I'll be oh, but see this. You've had pelvic issues this whole time. Huh. It was just this was maybe enough to kind of get you over that threshold to now it's problematic and bothersome in your day-to-day life. Or again, it's kind of how do I exercise during pregnancy? There's just so many more questions that come about during pregnancy and postpartum. It's just a huge shift and transition in your physical life.
Yeah. Okay. And so going into movement as a whole, what is the importance of movement during pregnancy? I know it's a very broad idea, but where does your brain go with that? And
So it's going to be one of those things where you're not that fragile, right? You can continue to move. You can continue to exercise. You might shift in some of your motivations and goals and why you're showing up and doing these things. But to me, and especially as a physical therapist, everything comes down to function. You have to move and function and keep up with your physical day-to-day life, you know. So again, it's not like you're pregnant and you can't do any of those things. You just have to be maybe a little bit more smart, listen to your body, you know, kind of stuff. But postpartum, like you have to then function again, right? And so, you know, you want strength through your pregnancy, and we want to recover and regain strength postpartum. Birth is a lot much more about like softening your body, getting pelvic floor to lengthen and open and get out of the way for uterus to do its job. And there is some physicality in terms of the like holding positions, changing positions, moving during pregnancy. So that's kind of where sometimes like having some physical endurance and some strength is helpful in terms of birth, but you don't need pelvic floor strength during birth. Like you need pelvic floor softness during birth. Again, kind of strength to support your pelvic floor, support your body through pregnancy, literally like hold yourself together as everything's kind of getting splayed out a little bit. And then again, that softness during that birth, and then again, recovering that strength during postpartum.
Okay. And so it sounds like lengthening and strength to a degree is important. I think of, for me, like I've been lifting heavy for years and years. So, and I actually did a brief bout of pelvic floor PT because I had a problem where I was peeing myself when I was lifting heavy. And so we did a little bit of like relaxation, breathing techniques, because we deemed that it was more an issue that my pelvic floor was too tense. And so for me, I almost lean towards, okay, you're saying everybody's a little bit different in this. I feel like I probably have a strong core, a stronger pelvic floor. And so breath work for me to be able to lengthen my pelvic floor. But the pelvic floor is one of many muscles in the core musculature. So then what about like, I don't know, global core strength? Like, you can do just a pelvic floor exercise or just an abdominal crunch, but what about bracing? I hear some things that are like, be careful with bracing. You're going to put too much pressure on your pelvic floor and it's going to create problems. You don't want to do too heavy of lifting. And then I hear some people that are like, just listen to your body. Like, you'll be fine.
Yep. So to kind of unpack, because there was a couple of different things that I could hit on in there. So in terms of bracing, it's how are you bracing? Right? So like you said, pelvic floor is part of your core stability. So sometimes people will teach bracing in a way where it's a lot of downward pressure, right? And almost kind of like not appreciating that the pelvic floor also has to support that, right? Versus kind of a like engaging through pelvic floor with your abdominals and creating like a top, bottom, and all around pressure stabilization, right? Versus sometimes I've heard people be like teaching like with lifting like brace like you're going to poop. Well, as you're pooping, that should be lengthening pelvic floor and kind of bottoming out your pressure.
Yeah.
Right?
That would be bad.
I've heard that a lot as given a cue, and I've always been like, I don't know
like
if
how
that
does
sits
that,
totally
exactly.
right.
So like shocking that like you're peeing when you're bracing, right? Like if you're being taught like push
Or you're
down.
releasing gas or something.
Yeah,
like,
exactly. And even I've had people who were like on a heaviest lift, like they pushed out their tampon, right? Like again, that's a ton of like downward pressure. I know. But so again, like that pelvic floor, like its job is to help support the, bottom up, right? And so even in terms of like what you're talking about with the like previous with lifting and like having some incontinence with that, like yes, we want the pelvic floor to be strong, right? But I need it to work more like a trampoline. It needs to absorb pressure as well as catch pressure. It can't be a cement floor that everything just like pushes down on, right? So going back to like the bracing while pregnant, like if you're having symptoms and heaviness and like, any incontinence, I would want to look at how you're bracing. Is pelvic floor with the team or getting overpowered by the team, right? And then in terms of like the lifting heavy and things like that. So yeah, if you are lifting so heavy that you're having like leakage, feeling of like a bulging heaviness, pressure, like a downward pressure, like that's more than just like, oh, okay, I'm working hard here, but like an overwhelming amount of that pressure. If you're having any like pubic symphysis pain or SI joint pain, which is like kind of lower back, like right where the dimples of your low back are, where your SI joint is, any of those things like might kind of cause me to question like, okay, like how are we lifting? And my thought process is always first like, let's look at how you're doing it, right? Is there mechanics here? Is there a mobility issue, a strength issue? Like, let's look at that. And if you're still having symptoms, okay, let's now reduce maybe the weight. Like maybe that's now time to go a little less resistance, a little lighter, because this is what your body can support through this. If not, maybe we need to reduce the range of motion, like maybe not the deepest of squats that you've done. Like maybe a mid-range is better for you right now. So yeah, it's never going to be this blanket statement of just like, don't do it. How are you doing it? And even right now, like your body just sitting here talking with me is committing more energy than it ever has before just to growing a baby.
Yes.
Yeah.
So it doesn't have a lot of extra energy for the extra stuff, right? You know, so that's where again, like modifying your intensity is relative, right? So for you, a moderately intense exercise is going to be so different for someone who's never worked out or maybe on the in-between, right? So you want to still, like, it's still okay to challenge your body, right? But you're in this like
look
long,
different.
yeah, it's going to look different for each person, right? So
I feel like it will look different for each person, but it's going to look different. Her challenging herself as a pregnant woman is going to look different than her challenging herself as a not pregnant woman.
Totally.
And she will adjust her workouts as she grows.
Yes.
So as her stomach grows, her squats might get a little less
Yep.
or a little higher, or you know,
Yeah, might
things
not be
like
as
that.
deep.
The weight will
My
adjust the
deadlifts,
weight.
my
Like,
stomach starts pressing against
yeah,
my
yeah,
quad.
exactly. So
Totally.
you adjust as you progress,
You're-
as you progress through your pregnancy.
Exactly. You're
you
gonna-
just make those adjustments
Yeah.
as you go.
Yeah. You're going to
based
have
off
to
how you feel.
Yeah, you're going to start taking like a wider stance because literally like you don't even have room for your belly, you
Yeah.
know, to like fit in between like a deeper squat, you know. So again, there's going to be those changes, but that's where usually, you know, like first trimester, you're not in that physical change yet. It's more kind of like just your energy, your
Yeah, my
hormones.
fatigue has been terrible. Actually, today
Totally.
feels good. The last week has gotten a little better.
Totally.
But yeah, that's been the biggest thing that I've been battling.
Yeah, yeah. So first trimester is going to look, your modifications are different because you have different reasons to modify. I just don't even have energy to show up and do it, right? So what's kind of just like the most basic, minimal, feels good for my body, you know, type stuff versus like pushing and challenging yourself, right? And then like second trimester, you're not quite yet big enough for it to be like physically in the way. You're hopefully getting a little bit more energy back. So again, that might be where you feel a little bit more like your non-pregnant self and like, I can do this, I can push. And then as pregnancy progresses, like your joints are changing. Literally your pelvis is kind of going from more like upright to now like shifting out because it's making room for baby. All your organs are moving where they are. Your pelvic floor muscles, your abdominal muscles, your whole body, you know, muscles are now carrying more weight than they ever used to, right? So yeah, you're not going to be able to do as much or lift as heavy, right? Because you're already working harder just like walking into the gym that day.
Yeah. Okay, so what are all the benefits that somebody gets, though, from lifting? And I guess let me preface this with how do you approach this for somebody who has never trained before? We'll just keep it simple and say someone who hasn't trained versus like a moderately trained individual.
Yeah.
Should they both be lifting weights? Is it safe to do it? And what are the benefits that they're getting from it if it is safe?
Yeah. So the answer, of course, is always going to be it depends, right? But again, kind of from my perspective, it's all about functionality, right? So your glutes, your quads, your hamstrings are not about to birth a baby, right? You know, so then postpartum, we need those muscles to do their job while abdominal muscles and pelvic floor muscles are healing, and like recovering, right? So the stronger you are and the better body mechanics you have, and even knowing how to utilize those body mechanics in day to day, the less stress and strain there are on pelvic floor and abdominal muscles while you're healing, right? So for someone who's never done anything, I might start with just simple sitting down, standing up from a chair, right? That is a squat. But for someone who's never trained, that might be enough for them that is challenging, fatiguing, tiring.
Just like some body weight resistance
Totally.
exercise. Maybe start with a little weight, but it probably wouldn't need much.
Again, it depends. Like there might be some people who just body weight is enough for them, and some people where it's like, okay, we can add a little challenge, to that. I also do a lot of like kneel to stand. So again, it's a basic lunge, but I'll have someone like kneel down on a pad and be like, okay, just stand up, leave your feet there and kneel down again, stand up and kneel down again. And we might have to raise that height depending on if they can handle that full depth or not. But again, when you're postpartum and like down on the ground with baby doing tummy time and then have to stand up from the ground, you need the oomph and strength to be able to stand up from the ground, right? And then just basic walking, right? Just kind of keeping yourself active. So that's where I would go for someone who's never done anything. It's just real basic, real nitty gritty. Can you function with your day-to-day life postpartum? For someone who's been training, especially at a higher level, we're not going to push or gain or try to do more. It's going to be, again, how can you maintain whatever you're able to maintain? And again, that might look different for each person, right? What's the challenges of their pregnancy? Or do they have like just an easy, great pregnancy that might only come down a little bit in their exercise intensity? So again, that's going to be more so like just maintaining, just feeling good, showing up, maintaining your strength, but not like looking to gain anything.
And so I hear that makes sense, which for me, it's like hard to dial it back being in this athletic mindset where I've always pushed my body as hard as I can.
Totally.
I signed up for a half marathon in a couple months ago, and then I got pregnant like a month later. And I was like, well, I've been running for a little while. I think I can still do this. And I have been. Because I remember I had asked you about it, and you were like, well, it's good for the endurance.
Sure.
And it sounds like as long as I'm listening to my body and not
Totally.
way overdoing it, that is okay.
Yeah.
Not looking to set any world records on this half marathon. I just want to
Totally.
check the box.
Totally.
You're pregnant.
Yeah.
Pregnant, check.
Exactly. So, and it might be, as a pregnancy progresses, like if it gets really hard for you to run and you just like, you literally feel unstable and like you're running on soft sand, right? Like it's just, you don't feel held together, right? Then that might look, that might look a little different, for you. So then maybe is the marathon, does the goal then shift to being like, I'm good with a walk run as long as I finish it? Or does it get to be where you're like, you know what? It is what it is. I can come back to this later. So like, this is just one moment in your lifelong athleticism, right? So often
It's hard to
Totally, exactly. And sometimes I hate comparing it to like an injury or a trauma or, something like that. But again, it is a big physical change on your body, right? And it's a season, right? So, not pushing so hard that you then sort of damage some things or cause some issues that you then have to undo to then move forward, right? Like just kind of, keeping yourself feeling good through that and maintain what you're able to and just know whatever's on the other side, like we can pick up and build again.
Yeah.
Right? So I love a quote where it's like, if you don't have time to do it right the first time, you don't have time to redo it. Right? So if you push yourself too hard through pregnancy because you're just so focused on like, I don't want to lose anything, you might lose more than you thought. And now you're working even harder to rebuild that.
Yeah. Do it right the first time.
Totally.
Yeah. But what my question was I always hear talk about training, lifting weights, whatever, cardiovascular health helps with your recovery and postpartum. But what about like during labor? Are there advantages to having, I guess it is the ability to relax your pelvic floor, the strength and endurance to push? I don't know, do you talk to women and their labor was easier? And even like tearing, that's actually something that I think about a lot that I'm like afraid of.
Yeah. Let's circle back to tearing. Okay. We'll first kind of talk about the like conditioning for labor, right? Because that's definitely a big, I think, talk of like, oh, like the harder you train, if you maintain your strength and your endurance, then your labor, would be easier, right? So again, there's some physicality in terms of like, we want to take advantage of how our movement and body positions can influence the position of the pelvis. So, of course, I always kind of laugh. I was like, I never show up anywhere without a pelvis because, like, it's hard to be like, just imagine. And it's like, no one's like, I don't know what that area looks like. So, in essence, during labor, like, baby has to go through a couple, transitions and phases. So, in early labor, baby has to make it into the inlet of the pelvis. So we're kind of talking about like this bony circle through here. So literally your pelvis has to kind of open up to create this space as big as possible during early labor. Okay. And so we can kind of, again, like use different positions, use your knees. So if everyone kind of like, as you're sitting there, you feel your sit bones underneath you there. Okay. If you then bring your knees wide, you're going to feel how those sit bones come closer together, which is going to open up that top. Yep, exactly. And then if you bring them back parallel, you'll feel them equal again. And then if you do your feet wider than your knees, you're going to feel those sit bones kind of open up and splay apart from each other. Okay. So again, in terms of like how we position, how we move, we can influence where your hips are, which is going to kind of pull the pelvis and open it in those different directions. Okay. So we need to kind of go from the inlet open, in the middle as open as big as possible, sort of in the middle of labor. And then towards the end, we need the bottom to open, the outlet to open as big as possible. So if walking, lunges, being on your hands and knees or a kneeling position, like all of those different things can kind of influence the position of the pelvis to make the path for the baby easier to get through. Again, if you don't have the strength to get into like a squat position, that's like one position off the menu board, right? For you to sort of choose from and utilize during labor. If you don't have the endurance to kind of like change positions, and it's like you're resting, but then moving and then resting and then positions, all, kind of depending on how long your labor is. But if you literally fatigue out, then again, that might look different because now you just don't have the energy to hold yourself up, to be on your hands and knees or, be in a kneeling position, right? Like, does that make sense? So that's where that strength and endurance and like conditioning is helpful, is literally holding and positioning your body in different ways that are helpful for labor.
Make the optimal route for the baby to come through.
Totally. Exactly. And it's not a straight shot. Like I'm like, if we're at like a crowded barbecue or a crowded party and I have to get to that side of the room, like I'm going to like walk this way and then like, oh, someone's in my way. So now I have to like sidestep and then back and then like over here. Right. Like, so it's not this like, okay, here, baby, here's your road on out of here. Right. Like, it's like they're maneuvering their way through that.
Yeah.
So that's why we're changing position and we're moving as much as able in labor.
It's wild to think about.
It is wild.
Yep. So that's where that strength.
Think about it that way.
Yeah.
I just thought it was a straight shot.
like come on through. Yeah. The amount of movement baby has to do and like tuck their head and turn and like it's complicated. It's complicated, right? So the more that you can move and position your body, you just provide space openings and options for the baby to utilize to make their way out.
Makes perfect sense.
So that's where, again, that like strength. And then again, postpartum, like the stronger you are, then the easier it is to just like stand up, walk around, things like that. It's not strenuous on your body because you already have built up that strength and endurance, even though you're recovering, right? Yeah. And then in terms of like that pelvic floor, like lengthening and the pushing. So news alert, like you don't actually have to push. You don't actually have to push. The uterus is going to do its job, right? So the uterus is going to do all those contractions to push baby out, okay? So you can just breathe and relax. And again, you might position yourself, and this is again where strength, if you have the strength to hold like a hands and knees position, then you can relax your pelvic floor because your glutes got it. Your quads got it. Like your back muscles, we've got this. We can hold you in this position and then you can relax there versus everything being like, oh my God, this is so hard. I can't be here, right? So that relaxing the pelvic floor, taking those deep breaths, softening your body as much as you can allows those muscles to stretch as baby is coming through.
Yeah.
Okay. So in terms of pushing, again, I would be looking at the mechanics of it. Like, can you create pressure? So again, just like we were talking about, like push to poop, right? Like, can you push to poop, create pressure in your belly and lengthen pelvic floor, right? You'd be surprised at how many people contract pelvic floor as they're pushing because they just they have a mismatch in their head, and no one goes in the bathroom with you and be like, oh, you're doing that wrong. Right? Until I'm there and not in the bathroom, but like I'm there and I'm like, hey, like pushing, like you need to poop. And they're like, do that. And I'm like, and I see every muscle engaged. And I'm like, oh, no wonder you were constipated. No wonder it took you 3 hours to push baby out, last time. Like you're literally working against yourself. Right? So it's a coordination piece there. So again, you don't need strength to do that. And actually to flip back to your thing with tearing, we actually want you to kind of push a little less hard, right? We want time for that tissue to stretch, and it's okay to kind of slow it down. Asterisk. Everything I say is like asterisk, as long as it's okay to slow down, as long as like you're okay, baby's okay, and like we can take our time with this, right? There might be reasons to be like, nope, out now.
Yeah.
Right? But if all is fine and dandy, it's okay for baby to crown and then kind of come back in a little bit and stretch a little bit more and come back in a little bit, right? Like that's a lot easier than popping the ketchup bottle, push as hard as you can and as fast as you can. And then that might lead to some more of that tearing, right? Because literally that tissue hasn't stretched and we're just forcing our way through.
Huh.
I know.
Can your positioning play a role in that? Like I've
Sure.
heard that, like an epidural, you can't feel much is what I've heard, and you can't move around much, which I am leaning towards not wanting to do that because I want to be able to move around and feel myself. But then you're stuck on your back, and then
Nope.
there's more not stuck on your back.
Not stuck on your back.
Okay, I don't know. So
I know. So there's a lot of ways that you can position yourself in the bed or even have a partner maybe like moving your legs for you or having your leg up on like, it's called a peanut ball. It's almost like two stability balls like attached together like a peanut. And they can like be rolling that back and forth so you can be on your side. You might still be able to be on your hands and knees. Labor and delivery beds can break down in a bunch of different ways. So you can literally be like, sitting on the edge, almost like you're on a chair. So you can still be in that upright or maybe leaning against the head of the bed to be in more of a kneeling position. So it does depend on like how much epidural, did you get? Did it knock out everything? And you literally can't move your legs. But again, still someone could be moving you for
I
you
have
and
heard that with
positioning.
people where they're like, I couldn't feel my
I
legs
couldn't
at
feel
all.
anything. Yeah. So I have had some people where they're like, I didn't feel a thing. Like I could have been like out having lunch. I like zero awareness. Yeah. And then other people that are like, you still feel pressure. You still feel something, right? So it's not like you feel nothing. So again, kind of depending on your dosing and maybe how sensitive you are, to medication. So yeah, you can still utilize some of the same concepts. Again, it just may take off like you can't walk anymore. You have to stay in the bed. So we can position you in the bed and be smart on the bed. But the whole reason of like ideally not laboring on your back is because, like I said, at the end, like we want the outlet to open as big as possible. And that includes the sacrum. So when you're laying on your back and all of your weight is on your sacrum, now it can't open and extend. So if you are in a position and you talk to your provider and you're like, hey, can I like birth in any position I want? And they're like, you can labor in any position you want, but like I need you on your back because that's how they've been trained. That's how the person who trained them has been trained. Like it's a whole long line of it. Then you can take 2 towel rolls or like 2 pillows and put them under, again, like the dimples in your low back or right at your kind of SI joint. So if you're laying on 2 towels there, then that's floating the sacrum there and will allow that little bit of extension to occur. Or my other favorite is like laying like kind of 3/4 on your side. So shove a couple pillows under your side here. And then again, that gets the weight over here off your sacrum and allow that to open and extend. Okay. So you can still move yourself in position and like be aware of things going on, even with an epidural. And then I lost the original question. What was
I think I was just trying to tie it back. I do want to button this up. And then we'll kind of close it up and do a part 2.
Yeah.
I have a question to circle back really fast about the pushing. Just really fast.
Yeah, what is it?
So you said you don't necessarily technically have to push, but you always hear, like, you see it on TV, you see it all the time, like, push. So is it like pooping? Like, it should just come out. Like, you should just be able to relax. When you go poop, you got to go poop. It just comes out. And if you got to push, then you're kind of like a little bit constipated or whatever. So technically, it should just kind of come out.
Kind of yes and yes, right? So for some people, when they go poop, like it's soft enough and there's enough like the intestines kind of propel it along, and all you have to do is, relax and it comes through.
Right.
Same thing with baby. Again, like if you just focus on the breathing and through each contraction, you're softening your body and relaxing. Again, uterus can get baby all the way out without you needing to push.
Yeah.
I just found it interesting when she said you don't have to push. I'm like, well,
don't
they always
have
say
to.
push. And
Totally. But, and for me personally, it's like when it was time to push, it was like every cell in my body was screaming, like, it is time to push. Like it is a sensation that I cannot explain until you have it. And you're like, holy moly, I need to push. And a midwife I work with, I love how she said it. Like, if you are asking me if it's time to push, it is not time to push.
Okay.
Right. So like we can go down this whole rabbit hole, but basically like as the baby's head sort of bottoms out on pelvic floor, it stretches those muscles and that little bit of that reflex signals, hey, baby's coming, it's time to push. So again, you can work with those contractions and give that pressure. Like again, like, and I always say like every bowel movement between now and baby is a good push practice. Like how can I push and create pressure and relax pelvic floor and lengthen and not bear down and give everything I got, but have a gentle, with that pressure down. So again, kind of slow down that pushing effort. But yeah, like, I mean, they used to put women like under with ether, whatever. And granted, there might have been like some forceps involved, but yeah, Hollywood is not the most accurate representation of like labor, birthing, and all that.
Yeah.
Totally.
Just
Darn
like in
it.
general.
That's right.
Yeah.
My educational material.
Yeah, exactly. But there is a difference between coached pushing and spontaneous pushing.
Okay.
Meaning, and I always kind of tell people, I'm like, if you feel the need to hold your breath, like that's okay. Like I don't want to make anything feel like, don't do this. We just want to know what we're doing. So if you're holding your breath and pushing as hard as you can for 2 hours, that might
get exhausted.
Exactly. That might be a little bit different than like trying to breathe through and pushing like with those efforts, but then occasionally being like, all right, I feel like I just need kind of like, again, if I'm constipated, I might push a little harder when I feel like, hey, that's right there. But again, I hate that we're like doing so much analogy to poop, but it is what it is. Like if I have the urge to go to the bathroom and I sit down on the toilet and I'm pushing as hard as I can, like again, by the time poop is here, I'm tired, right? But if I kind of give a little bit of pressure and a little bit of pressure and it's working its way down, and then again, you kind of get that sensation of like, oh, it's right there. Let me go ahead, get that one more extra push to kind of get it through, right? So that might be where I give a little bit extra effort, right? But as you do like your labor and like your childbirthing classes, you'll learn about the stages of labor. So like early labor is when like contractions are starting and they're kind of like coming together and all those different bits. And then all of a sudden it's going to be like transition, lots of contractions back to back to back. And then it might have a lull where you have like a little bit of a delay and let uterus do its job, get baby as close as possible, and then push with it. I know.
Yeah.
But we might have to be like, it's a whole discussion.
Yeah. I think we could dive all the way down that. So with that being said, I think we'll wrap it up there today. We are going to come back for a part 2 and dive into this even more because there's so much information with it. But Meghan, where can they find you on social media? What is the best way to reach you?
Yeah. So my business is Tidewater Pelvic Health. So website is just tidewaterpelvichealth.com. Instagram is Tidewater Pelvic Health. I am technically on Facebook, but really more of my attention is on Instagram.
Okay.
Yeah.
Right on. And y'all know where to find us. We're on Instagram, Facebook, Riverview Wellness. Heather's on Instagram.
Wandercoach 757.
So if you have any questions, please reach out, drop us a review if this information is helpful. And we look forward to seeing you guys for our part 2. We dive into this even more. Thanks, guys.
Thanks.